Dr. Sonia Ceballos approaches medicine with a unique perspective that began when she was a child. Growing up in Northern California, Dr. Ceballos grew up in an impoverished community. Her mother worked as an emergency room nurse, and Dr. Ceballos witnessed the impact of her mother being able to teach as a bilingual healthcare worker, and this experience led to her pursue a career in medicine. Dr. Ceballos is an MD who is passionate about specializing in women's health as an obstetrician and gynecologist. Dr. Ceballos completed her undergraduate degree in nursing from Loma Linda University and a medical degree at the University of California in Los Angeles. She finished her residency at Harbor UCL Medical Center and has also worked as an ER nurse. She is board certified by the American Board of Obstetrics and Gynecology. Please help me welcome to Divine Discoveries, Dr. Sonia Ceballos. Welcome. It's good to have you here on our Divine Discoveries program. It is our pleasure.
God bless you. And again, thank you for your valuable time. And certainly thank you also for your expertise. Just hearing the history, your history, as we receive it as a blessing from God to have certain individuals upon this earth that really have a passion and a concern to get individuals the very best health care that they can receive.
Amen. So we just really believe, Dr. Ceballos, you all work along with God in helping to provide healing for many people. We know God is the ultimate doctor, but he also needs hands and feet. And we look at you all as those that God used to help facilitate healing for men, women, boys, and girls, everyone. So we appreciate you doing that for the community.
Well, amen. Thank you.
I'd like to start with a question, and since we're doing women's health care, women tend to be the caregivers for everyone else. What do you think is the importance of women taking time to care for themselves?
Well, like you said, they are many times the caregivers in the family and therefore the cornerstone of the family. And so when mom gets sick, I remember when my mom had her hysterectomy, where was dinner? Who was getting everything ready for us to go to school? Those 4 days in the hospital, we felt that as a family. My youngest sister was born on Thanksgiving Day. Thanksgiving dinner was not the same on that Thanksgiving Day because mom wasn't there.
Wow.
And even though we were eating a very non-traditional Thanksgiving dinner, being from Hispanic background, we missed her very much. So it's very important that those people who are going to care for every family member, young and old, that they cannot pour from an empty cup. They must make sure that they are taking care of themselves. And so ensuring that they too have a primary care physician. They too, in addition to their primary care physician, that they have an obstetrician and gynecologist. And then depending on any other medical issues, making sure that they have a subspecialist that's caring for those particular issues.
Well, Doc, that's listen, really appreciate that answer. Let me ask you a very direct question. Being a woman of color yourself and a minority, is there a disparity between women that are minority getting the proper health care that they should?
We know that there is studies, research. I'm sure we all have stories. When the people who are caring for patients is not reflected in the care provider, you're not going to get the same type of care. Yeah. And as a woman of color and as a Hispanic female, when somebody comes in and speaks Spanish, I know I probably have some idea of how they grew up. I have some idea of what they're eating at home. I have some idea of so many details without them having to say one word. And that depth of understanding And that ability for me to attack particular issues, address particular issues with my patients. There's a card that I'm given and an allowance that I'm given because I too am a woman of color, that perhaps somebody else couldn't discuss a particular issue or address a particular item. But yes, there is incredible disparity. We know that even when you correct for education, so even a highly educated woman of color is still at higher risk. When you correct for financial level, so even if I make a lot of money as a woman of color, if I go into an ER, I am not going to get the same type of care. And so it is so important from the very beginning that we encourage education and healthcare, and that as we accept people into medical school, as we accept people into residencies, that they reflect the population that they're going to serve.
Well, that is so excellent. Yeah. Mm-hmm. Can I ask a follow-up question then? Now, in order to try, based on what you just said, and I think that is so important, because we kind of need to know, in order to have the best health care, we need to kind of know what confronts us and how to overcome it. As a pastor myself, that really care for the people that are my parishioners, is it important that when a person does go to the ER or they are admitted to the hospital, that they have family members that are there and come visit them or even spend the night with them? Does that add to, or can that correct some of the disparity?
I think that it does. I'm almost embarrassed to acknowledge that, because this is my world of healthcare, being a healthcare provider. But yes, I've heard patients say that to me. Dr. Ceballos, if you had been there, I know that nurse wouldn't have said that to me like that. But I was alone. Or when I wake up, I want to see you there to make sure that I'm treated appropriately. So as much as it pains me to admit it, it is unfortunately still the reality. And so I would encourage us to have not just a family member, but I think even more importantly, somebody who is aware of the right way that things ought to be done. So if you have a family member or a friend who is familiar with healthcare, who is a nurse, that's the person you want to bring, because otherwise then nobody knows, right, what is actually appropriate.
Listen, we really appreciate that transparency, and really you are giving us an education that many times is lacking. Can I take it one step further? And then I'm going to turn it over to my wife. But as not only a pastor, but I'm a husband, and I am also a father. I have a daughter. I heard something. I don't know if this is true, but I heard something once on a panel discussion of MDs, and they were all MDs and PhDs. And the statement was made that in years in past, when there was studies that were done for healthcare, it was geared toward the male and not the female. And when I heard that, I just could not believe, how can we research what needs to be done to the individual without parity? Is that the case in your education and your experience? Have you, number one, is that historic statement true?
Well, we know that it's true. And that's part of our education as physicians as well, to understand and look at history so that we don't repeat it. But yes, it's not only been done in regards to ethnicity and race, but it's also been done in regards to gender. So having 100 men that you evaluate and then getting that information and applying it to females is not appropriate. We're very different. We're literally, sometimes it seems, from different planets, right? There's hundreds of books written about all of that. And so we know we can't. A whole specialty exists for women's healthcare because it is very particular. But it is again the same answer, that people of color have to be part of medicine, because I, as a Latina, am going to care most about those things that I am from. So the place, California, I'm Californian, right? Dodger fan, all of those things, all of it. The good, where I came from, where I grew up, mom, education, all those things she instilled in me, God, all of those things are going to be reflected in how I practice. And so we have to, again, reflect the population so that respectfully, things will be studied according to the population that we're reflecting. So more Latinos, more African Americans, more people of color means more research that is pertinent to those populations.
This is really so good. When the committee came to me and said, listen, we should do a program on women's health, I was saying, are you sure? They said, well, listen, it is not just to educate women, but also men need to be educated. I remember once I was in a pastoral seminar, and the question came up about menopause. And many pastors did not understand the female side of the congregation that would go through menopause. And they were saying there's some male pastors that think this is a spiritual problem, or this is just a emotional, mental problem, because men do not understand the particularities of female medical treatment or what needs to be done for the situation. So while the committee was convincing me to do this whole program, I'm sitting there getting an education. All of a sudden, I had an epiphany. A light came on. Many times, men do not understand the needs of women. And so we applaud you, Doc. We're just so glad to have you in the field that you're in and be present. Dr. Wansa,
Can I just say one thing after that? Because even sometimes when we explain it, you're still not going to quite understand it. And I'm going to give you an example. There are female OBGYNs, and I'm talking about reflecting the community you serve. So we have male OBGYNs and we have female OBGYNs. Now, I don't know what a male OBGYN is thinking when their patient is telling them about cramps and flow and pregnancy and back pain and contractions. But as a woman, I'm sitting there nodding my head. I'm almost rocking with yes, 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 right? I understand. And so there is only so much understanding that can happen when you are not that race, when you are not that gender, when you are, right? And so all of those things are so important. So you bring up a point that is so valuable. I love when my patients bring their partners, because they get to hear the education that I give to every patient. They get to hear it coming from a reliable resource. And when they are not there during the pandemic, I had 2.5, 3 years without partners there in the room during prenatal care, during annual exams. And I missed being able to explain to a husband, a boyfriend, a partner, about the details and the intricacies of this woman's experience. So yes, thank you for bringing that up.
Oh, that is so excellent. So excellent.
Wow. Mm-hmm. We haven't even got into the program, and you just given us a plethora of answers that questions that we had we didn't even have to ask. That is just, this has just been phenomenal. Mm-hmm. And it is so true. When I came along, as a matter of fact, when I had my children, they're older now. I know I look younger, but they're older. I'm younger. But, Dr. Ceballos, we didn't have a female gynecologist or a female obstetrician. All three of my children were born with a male gynecologist. Now, I was a little uncomfortable because my background is very conservative. So when I had to go in there and you expose yourself, they don't understand, but you feel like that's all I can do. I didn't feel like I had any options. So to go in there and talk to him about where I'm feeling, my problems, you're not comfortable, but at that time you felt like I don't have any choices, so what do I do? But you bring about a whole different perspective to reality. When we hit reality, as you're talking about the reality of it, no matter how much they study, no matter how much they go through learning these different things, they'll never know the experience of it because they don't have to deal with it. So you have just done a phenomenal job just answering questions that we didn't even have to answer.
Well, Doc, quite honestly, you're breaking down some walls here. I can't wait till we air this. Is because I guess the follow-up question would be, because we are kind of dealing with the mentality of it. The follow-up question would be, is there hesitancy on females to actually go to and get the help and the treatment that they need when they know they have to go to a physician for issues that may be very private to them? Does that really create a wall? Have you found that, Doc?
Yes, of course. Of course, right? So the things you can tell another woman are completely different than what you can. I have sisters and I had a brother. Very different conversations. What we're talking about with my sisters, I can talk about everything, right? With my brother, we're going to talk about sports and, maybe some other things. But with my sisters, I can really talk to them about anything. And it's going to be the same type of experience when you're with a female provider who is your obstetrician and gynecologist. I say to friends and family, when I am taking care of my patients, I want it to be as if you happen to have a best friend who's an obstetrician gynecologist. Like, we are really just sitting and talking. And if there happens to be anybody out there who is my patient in your congregation, they're going to tell you that. The first thing I do is sit down. Nobody's in a rush. Do you have any questions or issues? Let's talk. And most of it is talking. My exam takes 2 minutes. And most of it's, what do you need? How old is this woman? What is she going through? And why is she sitting in front of me? Because what I know as a woman of color who talks to her patients and is well educated is that this woman has waited 4 to 5 months to see me.
Wow.
I am not going to rush through this visit, right? So, yeah.
Wow. That means, Dr. Ceballos, you care. And that's a whole different thing. It's just not something you do to make a living, but you honestly care about people. And that's kind of an art in our world that's almost non-existent. People just doing things because it's an income, not because they care. That's beautiful.
It is. Now, as a male trying to understand and to step into this wonderful conversation we're having, I know this is Breast Cancer Awareness Month, okay? But not quite honestly, has there from one century to another and in decades, has breast cancer really accelerated, or has breast cancer always been to the level that it's been? Like in 1920, let's say, is it the same as it is in 2020? Or is there something that's happening that is bringing on more breast cancer or cancers as a whole? What do you think, Doc?
Those numbers are all going up for women because women, our life was different in the early 1900s than it is now.
That's good.
More women smoke than in the 20s, right? It wasn't okay to smoke, but once I started working, I was working next to you, then just like you were drinking scotch and having a cigarette, I could too. And that's brought out a whole other set of risks that were happening to our patients. So number one cancer among women has been breast. And what is also interesting is that cancer number 2 and 3, most people wouldn't guess what they are. So everybody's going to know, I'm going to go in and get my pap smear. I'm going to go get my mammogram, even though I don't want to. But they don't understand why I'm asking them to do the other details during those visits. And that's why it's important that we sit down and explain. If a patient doesn't understand why I have prescribed a medication, they're not going to take it. Or if it's inconvenient, they won't take it. Compliance with prescribed medications is about 35%. You know why? Because they don't understand why they're taking it.
Wow.
If you explain that to them, My patients are very compliant. They come back when I ask them to. Why? Because they understand the risk and the reward of coming back. So we have to sit down. We have to talk. We have to educate. We have to explain. And not just explain it in my doctor language. I have to explain it as if we were sitting over a dinner table chatting at the house. They have to be able, and I tell my patients this, you have to be able to call your friend on your way home and tell her exactly what we talked about.
Wow. Boy, listen, where you been all of our lives? I can't.
I've been right here. That's the crazy thing.
Now, just one more question, because this is fascinating talking to you. But while you were in medical school, what you're giving to us now, did they teach that to you, or is that something you received from like your mother or your life experience?
Or both?
So you did say my medical school, but you left out one very important part of my medical school. I went to Drew UCLA. And what that was there was 175 medical students in my graduating UCLA class of 2006. 24 of us were committed to the medically underserved. So all of our rotations were in medically underserved areas. Martin Luther King Hospital in Compton, all the hood areas. And for many of us who were part of those 24, that was home. I didn't feel uncomfortable there. I went and ate there with the people, as they're referred to. Those were my cousins, right? So it was part of what we were already from. So yes, my family, my mother, a very religious woman, we were poor, but what my mother understood deeply was that education was going to make all the difference in the world. And if I was educated, and I did go to only religious schools until I went to UCLA, she understood that if I had those two components, that it really didn't matter what I became, it was all going to be pointed in the right direction, helping humanity, et cetera. And so, and then she exemplified all of that, right? She was a nurse in the hood. So I saw her incredibly patient, and with her colleagues, with her patients, and with us. So I think much of who I am today is because of that, but it's also because of my education. And, kudos to UCLA, who dedicated one part of their medical class every year to the medically underserved.
That is so excellent. I'm having the most interesting experience here, and I know this is women's health. But actually, I'm be honest with you now, and I'm gonna step out on this limb. But just talking to you, I'm starting to feel better. Now, what I'm trying to say is that there's something about a person that connects with the person. So while you're practicing medicine, and we'll call you Dr. A, but if Dr. B is kind of just very clinical, maybe concerned about his profession for the money that it can bring, or certain something, what Dr. A, which is you, compared to Dr. B, would your patients be more likely to survive, to be healthier, or to be able to heal quicker?
Mm-hmm. She didn't have to think about that.
Yeah, that's wow.
Here's the other component that will happen. When I'm sitting talking with a patient, I am educating them about the fact that it's okay to have a conversation with a physician. Mm-hmm. We're not untouchable. I'm not better than them. We're here sitting, chatting, talking like two people, human beings. Mm-hmm. So when they hit the hospital, they have that same expectation. And that changes the experience.
Wow. I'm gonna let Dr. Owens answer a question, because I was
about to say something.
I honestly, okay, just one more maybe out of the box question, okay? Because, and I really can feel your dedication, and of course your education, but certainly your dedication as well. But what does a good doctor like you do on your bad days? I mean, you got family, or you can have things go wrong in your family. You have pressure. You have a life, all right? And in life, you can have troubled times. But when you know you got to go in and minister to sick or dying people, what do you do, Doc, on your bad days when you wake up to a personal problem, but you got to go deal with, or you're in a profession that all you deal with is problems?
Wow,
Okay.
that's good.
What do you do, Doc?
That's good.
Well, when you grew up the way I grew up, every day's a good day.
Yeah. Wow.
I mean, I have look at my wall in my home office. There's no complaining here. I know where I came from, and it's all up, right? Here's the thing. No one at work is going to know, and the only reason you're going to know is because you asked me the question. I've been up since 1:45 this morning. I've done 2 emergency surgeries. I saw 16 patients this morning. I had to meet with 2 faculty members who didn't do a great job with a resident. You know, that is my day, and I consider it a privilege. I thought with both of those patients and emergency surgeries, better me than anybody else here at this bedside, because I know I'm going to give them great care. I don't know if so-and-so was on call, if they would get great care, but I'm going to talk, I'm going to explain. She's going to know why this is happening, what the expectations are when she leaves here, what's going to keep her safe, what's going to keep her from having this happen again. I'm going to go through all of that. So I consider it a privilege. It's my perspective, I think, that I don't have bad days.
Wow.
And I know that sounds crazy and cheesy, but I don't.
The calling upon you. Yeah, your professional calling is what this is, real quickly, and my wife is going to take the next question.
Oh, I don't.
But I think you really just changed and added to my prayer discipline. I've always prayed for my parishioners when they got sick. But now I see the need to pray for people like you. What you have to do, you need a community of prayer to give you the ability, the strength, not to suffer what I would term doctor burnout. Okay? That is how even the scripture said, Jesus said that, the sick need a physician. That's what Jesus said. This is amazing that just hearing that, I think we need to know and who to pray for more than we do. All right, my wife is taking it from here. Mm-hmm.
I'm almost lost. I don't. He's taken every thought, my questions. We didn't rehearse this, so I had no idea he was going this direction. But I mean, Dr. Byers, you have done such an excellent job of just pouring back into us here at our church, and I'm sure all those that's going to watch this video. I'm almost, my mind is almost blown at how much information you've given us in such a little time, and vital information, very vital.
Critical.
Things that, probably things that we think about, but you don't never be bold enough to ask the questions. It's always in the forefront of your mind, but you feel like, you shouldn't ask those questions. But you really just met us where the rubber meets the road. We have been so enlightened on this evening.
Yes, we have.
I'm overwhelmed that, as Bishop said, your transparency, your realness. I don't know you personally, but I feel like I do know you because you said the very thoughts of my heart and mind. It has been just a privilege to have you here. I don't even know how to ask my questions anymore after that.
Can I ask her one more? And I know this is women's health, and I told my wife when we walked in here, I said, okay, you got the questions. I'll just ask, the color questions. I'll just be a little color to the interview. But just so you can get your questions together, let me ask this one. But if we go to the clinical side, Doc, what would you say are the 5 most important things that you would express to our viewing audience for women to maintain good health? I mean, if you could list 5 things that they should do, or even 5 or 2 or 3 things that they should not do, what would they be, Doc?
Number one is don't smoke. It increases the risk of every single type of cancer. Wow. And here's the thing about living in Las Vegas is that I'm from California where no one smoked. I mean, I'm sure there were people smoking, but nobody smoked. It was not cool to smoke, so nobody smoked. I came to Nevada and I'm like, oh my God, everybody smokes. Yeah, right. So even just going anywhere, you are exposed to secondhand smoke. I love the masks for all kinds of reasons, not just because of COVID, but because it ultimately protects us from other people's decisions as well. But that would be number one because of the risk to every single type of cancer and so many illnesses. And if you have something, it's going to make it worse. Second, you have to have a primary care physician. We have to start with the very basics. We can't get all complicated and not start with, you have to have a doctor, and you have to help that doctor be a better doctor. Mm. There is something called the patient's Bill of Rights. And part of that Bill of Rights is you should get answers to your questions. Wow. You should have questions. And then you should expect answers. Wow, that's good. If somebody says, I'm going to prescribe you this medication, don't just say, okay, doc, what are if they're not going to tell you on their own, which my hope would be that they would, what are the risks and the benefits of taking this medication? What happens if I skip a dose? What happens if I don't take it? What happens if I have side effects? Those are the things that make doctors better. And if they're not going to do it on their own, then I would encourage you to help them be better by asking thoughtful questions. I love that people trust me so much, but I don't mind being questioned because it allows me an opportunity to educate my patients about the things that they care about most. So first, you have to have a doctor. And if it isn't somebody who's going to give you answers, you need a new doctor. Mm-hmm. And if we just keep going to doctors who are not doing their job, mm-hmm. then we will always have mediocrity, right? So fill out the evaluations when it's sent to you. Don't say, I don't want to do that. I don't have 5 minutes for that. Take those 5 minutes because that will change things. People look at my evaluations and say, hey, good job. Hey, what happened with this patient, right? So all of those things matter. They're sending it out because somebody does care about those answers. So filling those evaluations out does matter. When a hospital experience was not great, make sure you fill out that information and thoughtfully and kindly, but clearly with details. And so raise the bar on expectations. But I think we do need to be in both directions, kind and thoughtful. So that's number 2 and 3, have a doctor, have a primary care physician, but also have an OBGYN if you're a female. You need that particular lane. We don't just do pap smears and send you for mammograms. We talk about what is important in that decade of your life. So if you're 18, that's a very different conversation than if you're 38 or 58. Mm-hmm. We're having a completely different conversation because different things are. And everybody thinks that they're coming to see me for a pap smear and a mammogram referral. That's going to be 2 seconds of our evaluation and time together. It's going to be what is most important to you right now? Not getting pregnant, staying pregnant, menopause, hot flashes. Your mom had breast cancer at this age. It's endless. And somebody will say, well, I had a pap smear last year, so I don't have to go in. You are missing the opportunity to sit with somebody who it's their job to help you in this lane.
All right. Well, Bishop asked you a lot of questions. I thought 3 would have been good for you to give us. I'll just give you number 4. Number 4, make sure your spouse goes with you when you go in for the test. That's your number 4. Make sure they go, which they usually don't. Okay, but we're going to ask the last question. This is kind of a little loaded because sometimes women may feel like I only need a doctor at a certain age. So I was wondering if you had to categorize women going to the doctor? What do you think the needs of a teenager to the 20s would be, 30s to 40s, 50 to 60s, and after 70? What would you see the need at this age for them to go at these different times?
So teens to 20s. I saw a 14-year-old this morning. I love that she was there because I just wanted her to know you can come to see a gynecologist and nobody's going to touch you. No, you're not going to sit on this crazy bed. We're not going to do anything that's on that table. I'm just here to talk about the basics. What's a normal menstrual cycle? Nobody knows that, those details. Everybody just, I don't know what everybody thinks until they meet me, but we talk about the basics: menstrual cycles, safe sexual practices, contraception. Those are the primary things in teens and 20s. Okay. After that, 30s and 40s, menstrual cycle again. How is my menstrual cycle going to change? Perhaps fibroids, very, very, very important in women of color. If I'm doing a hysterectomy, typically that's going to be a woman of color, but I'm glad I'm a woman of color doing that surgery if she needs it and if it's indicated. And because we've exhausted every other possibility of care and she's failed them, that we're here in this room right now doing this particular procedure. So we're going to talk about fibroids, again, the menstrual cycle, making sure she knows that. Now, when we're talking about contraception, we're talking about long-term contraception. If I'm in my mid-30s, 40s, I may not want to get pregnant again. So now what am I doing? Am I taking a pill every day till I'm 52? Or am I thinking about sterilization? And again, to even say that word to a woman of color, if you're not a woman of color or if you're a male, that's going to feel different to you receiving that than if it's me, an older woman, talking to you about contraception and why it's important that you not take hormones, the risk that's associated with taking hormones. And now somebody begins to understand this is not about you wanting to sterilize me. This is about me wanting to keep you safe because taking hormones as I get older becomes more and more risky. Okay. Mammograms, of course, in 40s, every year after 40. By the way, there's different recommendations for mammograms depending on whether you're talking to an OBGYN, that the only people I take care of are women. My recommendation and the College of Obstetricians and Gynecologists is going to recommend a mammogram every single year. If you're talking to a family physician, they're going to say it's fine if you do it every 2 years. But they're taking care of a lot of different people. But in Women's Health, we recommend every year. And then the type of mammogram. And what does your mammogram result mean? What does it mean when you get a mammogram result that says normal, but dense breasts, right? What does that mean? Does that mean anything? Why does it say that? And making sure that we're explaining all of the different scores that we can get when we get our mammogram. And then 50s and 70s, menopause, the infamous menopause. And what do I do? Does everybody have hot flashes? No, everybody does not have hot flashes. Most women do not need to take hormone replacement therapy. But if you are that woman who needs it because she needs quality to her life, if we're going to live till we're 87, how do we do that safely? And so it means close follow-up, but it also means explaining benefit and risk. And when the benefit outweighs the risk, you do it. When the risk outweighs the benefit, you don't. And really breaking all those details down for your patient. Colonoscopies, DEXA scans. Once I go into menopause, the strength of my bones changes. Not immediately, but once I'm 10 to 15 years into menopause, if I fall, there's a significant risk. And for me to know what that risk is, I have to get a DEXA scan. So when you say to somebody, you need a DEXA scan, and I don't explain why she needs the DEXA scan, I'm not going to get the same compliance. So giving that explanation. Over 70s, risk assessment is different, and it's based on family history, your history. Do we stop doing pap smears? Probably. But because no one knows why they're getting a pap smear or what a pap smear is for, they're going to push back. So we have to explain, and we have to know, why am I getting pap smears every year? People get them every year, and I can tell you 90% of women have no idea what it is looking for. They think it's either everything well, just most of them think we're looking at everything, and we're not looking at everything. We're looking at literally one thing. And do we continue mammograms after the age of 70? And again, a provider in women's health, yes, we continue to do mammograms. So there's a lot of things that happen because I'm in menopause that we tend to focus on in the 70s.
Okay.
That's good.
Wow. We almost feel like saying amen. This has been so great. This has
My
been just
mom would be
great.
happy if you did.
Well, this has been great. I don't know
Excellent.
your mom, but she certainly did an excellent job raising you the way
Yes,
you
she
are.
did.
Excellent
Yes, she
job.
did.
Well, I guess that's going to conclude our program. We've gotten so much information, and you have just made everything so practical. I don't think I've ever talked to a doctor before, and they have been this, I guess I don't want to say plain talk, and made things so simple to understand. Matter of fact, I could sit here another hour and listen to you.
Yeah,
But
this
for-
is Doc, you make it very comfortable. You almost have a gift.
Yes, that's
yeah,
it, honey.
yeah,
a gift
it's almost like a gift. Some people have a gift to speak. It's almost like you have a gift to administer medicine or health to people. And I know we have to go. But if I could ask half a question, and this is just half a question, okay, or a quarter of it, what about stress, Doc? Does stress affect a woman different than it affects a man?
Well, I don't know much about men's health, but I can talk a lot about women's health.
Is stress a major factor? Is stress a major factor with women? Uh-huh.
What I know about humanity is that it's all connected. We're all connected. It's not, and you know that as somebody who came up in the church, my spiritual well-being is going to affect my physical well-being. And so I believe it's my background in nursing and the fact that my mom is a nurse. You realize that a person is made up of spiritual components and physical components and emotional components, and that they all are entwined, and you can't take care of one without addressing the other. I have seen in the last 3 years more depression and anxiety than I had seen in a whole career. And so people are feeling depressed and anxious. And I think it's because as human beings, we need to be with each other. And the pandemic, and I think also technology, has not made it hasn't been able to either be possible or it's not necessary. If I can just text you, I don't have to call you, I don't have to hear your voice. And we really do need to, in my opinion, get back to sitting in front of each other. And just like if you're at church, being together, singing together, talking together, praying together, all of those things. And it's important. And so, crying together, I cry with my patients. It can happen. It's okay. But yes, there is a significant emotional component that is part of taking care of women. And I'm sure it's different with men because we are different. Yeah. I tell my patients sometimes, especially when I'm dealing with postpartum depression, is that one of the most significant components is that a woman feels after she's had her baby and is exhausted and hasn't slept is resentment towards her partner. Wow. And it's because he gets to walk out of the house in the morning, go to work, and she has not slept. And then he comes home and then he eats dinner and then he goes to sleep and then it all happens again. And there doesn't seem to be an understanding of what is needed. And I acknowledge that, but I also acknowledge the fact that we need this other component of this individual who sees things very black and white. If you need to sleep, go to sleep. Yeah. That thing that we can't quite do like that, but having that person as part of our life does move us in that direction as much as we move them in our direction. And both are necessary. And so there is value. And so I try to bring people together, even though the resentment is real, the feelings are real. And I don't say resentment in a negative way. I just say it in a way that there's an opportunity to bridge the value of each of those very different individuals together.
Amen.
That's so good.
That's great.
That's so
Well, again, Dr. Bias, thank you so much for a
Yeah.
plethora of answers,
Mhm.
questions, information. We appreciate your time, and just thank you for caring. One thing I like about through the whole program, you never called the people that are under you patients. You never said one time, and the patients that come, you've always said my patients.
Wow.
Throughout
Yes.
the program, she used the word my,
Mm.
and that really connected with me, that how much you care. So again, thank you so very much for taking time with us, and I'm sure you not just helped the congregation, but you have helped
Yeah.
thousands and thousands of people that are going to
Yes.
listen to this interview.
Mhm.
Thank you for caring, and thank you for taking time.
And thank you for being you. Yeah,
Amen.
God bless you. Mhm.
God bless you, and we'll be
You're
praying
welcome.
for you.
And thank you for the invitation. And thank you for all that you do.
Thank you.
Appreciate you.